Hi, this is Annette Guy. This is interview assignment number 1. I'm here with Rita Moss, nurse practitioner, and we're going to answer some questions about being a nurse practitioner. So Rita, if you don't mind, introduce yourself to the
Okay.
class.
I'm Rita Moss. I'm a nurse practitioner. I've been a nurse for a very long time. I graduated nursing school in 1983. I completed my 2-year program, and I've been a nurse practitioner since 2012.
Very good. Why did you decide to become a nurse practitioner?
I got interested in becoming a nurse practitioner after I graduated from nursing school. I got a job at the hospital, which I loved. And there was one nurse practitioner that worked there, and I'd been reading and hearing a lot about nurse practitioners, and I thought, wow, that's something I think I'd be interested in. So interestingly enough, I applied. Mayheck used to have a program.
Mm-hmm.
It was an 18-month program, but they had just started requiring you have your BSN to get in the program. So I started my BSN program, finished it in 2 years, back in the late 80s. I was told when I applied, you can't do this in 2 years, but I did. And just as I finished the program, they had accepted their last class and they closed the program.
Wow.
Because they were making the decision to step up the nurse practitioner and make it a master's prepared program.
Okay.
So Mayheck closed their program, and I said, well, okay, maybe another time. So.
Okay. And when did you go back to get your nurse practitioner?
I was in Western's first nurse practitioner class that completed. I started in 99. I think we had 25 students that started, and I think we graduated, 18 is how many completed the program.
Okay.
A lot of them dropped out for different reasons, but, over the course of the 2 years, but, we graduated, 18, so that was good.
And now you're working on your doctorate?
I'm working on my doctorate. I will finish May 6th is graduation.
Congratulations.
It's coming quick. It's like, I got a lot to do, but I can get it done.
So how does your commitment to patients and your profession affect the type of care you give patients?
I think when I first came out of nursing, I had a lot of good role models. I first had a job in the nursing home, and that was very fast-paced. I was like the only nurse on the one end of the hall that had there was one end that had 43, the other end had 46. So you either had 43 or 46 patients. You passed medications to all these people. If there were any occurrences, such as a fall or any incidents, somebody was sick or whatever, you dealt with all that during your shift. So that job was very demanding, very busy. I learned a lot, though. But I knew I wanted a job at the hospital, and when I finished nursing school, there were no jobs.
No jobs.
The market was really kind of flooded. So it was interesting, and I still remember the girl's name that left the hospital that I interviewed for her job and got the position. It was on night shift, and I was very thrilled to have the job. But I started, and again, a lot of good role models, a lot of nurses that were good at mentoring new nurses that came on, and the orientation process, was very difficult because the shift was busy. I started in the orientation, and after a couple of days, they're like, okay, we're busy now. You're just going to have to take these patients.
And they just put you on the floor.
They did, but I also had a lot of good support.
Oh.
The nursing supervisor was very interactive with us, and, she would come by and check on you, make sure you're doing okay, and made sure if you needed help starting an IV, she was there to help you. I remember the first time I put down an NG tube. I'd never put one down in school. I knew how to do it. I could read up and read the policy. But, and again, we had good nurses that we worked with, collaboratively. And, I asked one of the nurses that I really, respected and wanted to be like, will you come with me? And she said, oh, sure, come on. I'll help you. So she didn't help me in that she did it. She was there and, monitored me, and I did fine. I didn't have any problems, but there were a lot of good staff. So I think that was important, coming out of nursing school and getting that first real nursing job that you get your feet wet. And we had a lot of physicians that were very good teachers. That was back in the day when they did rounds twice a day. They came by in the morning, they came by late in the evening typically. And, I worked the evening shift, so the evening shift was a little more laid back, not quite as, your hair on fire to get the discharges out and the new surgery patients in. And, they were good teachers in terms of, what's wrong with this patient, what should I be looking for. And that was back in the day as well. We had 3 beds on the 2 East unit that were monitor beds. And if we had somebody on the vent, those are the rooms we put them in.
Oh, not in an ICU?
No, we didn't have an ICU at the time.
Oh,
I remember when they started the building project and built 2 North and the ICU. So, I'm really dating myself.
So
I've been there a long time, but...
How long did it take to feel confident and like you could handle, how long from the time you became a new nurse until you felt your confidence like you could handle a full load by yourself? And
well, quickly I was, taking a full load, but I probably about, a year, and then I started feeling a lot more comfortable because again, we had we had medical and surgical patients kind of all blended in with the acute care patients and, MIs. We did, that we had a lot of heart attack patients that we managed. Because, now we never get a heart attack patient on the floor unless they're old and not, eligible for an intervention. But, probably about a year, it took me to really start to feel comfortable. And we had the telemetry monitor on. And again, the supervisor that we had at that time, she taught some classes on tele, so we would come in sometimes early in our shift, an hour early, hour and a half early, and we would sit through an hour class, and then that gave us 30 minutes to transition into our shift work. So I, took every advantage I could on that. And we used to have one of the internists, we had just a bulletin board on the unit, and he would, every week, he would post a monitor strip. What is this rhythm? And then he would come back later in the week and he would put what the answer was. So, there were a lot of opportunities like that we had to learn. And I think things are so busy now, we just don't have that anymore.
I think that's true. One of my pet peeves at the hospital now is we don't offer as much nursing education as we should.
I try to take advantage if I hear a murmur, if I see something that's rare or uncommon. I try to take advantage and, bring the nurse in, and I'm like, come on, I want you to look at this. And the students, I like to get students involved in that too, because, working in a small hospital, you'll see things that you won't have the opportunity in larger hospitals to see, because you're going to be more specialized on a, certain unit, a cardiac unit or a neuro unit, and you're not going to get to see the broad, from birth to death spectrum that
you see in a smaller hospital.
In a small hospital, for sure.
So you just basically shared your professional self-confidence, but how do you manage the constant change and chaos in the clinical practice setting? How all the time our core measures are changing and our rules are changing and our protocols are changing. How do you handle all the change from one situation to another?
Well, I think the first thing, change is inevitable. It's going to be there. So if you dig your heels in and say, I'm not doing that, I'm not changing the way I do things, then you've buried yourself. But I think you have to just go with the flow. Change is inevitable. It's going to happen. This whole switch over, conversion over to ICD-10 and the new, the documentation codes are changing. They want more, detail in the documentation. And I try to do detailed notes anyway. And I try to always, position myself when I'm doing my progress note, my discharge note. I'm trying to say, okay, if I fall over dead today and somebody has to come pick these patients up tomorrow, if they read my note, they should be able to know everything that's been going on with this patient during their hospital stay.
Right.
So I try to be very detail oriented, and I try to keep up with classes. I read my journals. I go to a conference once a year. It's a big nurse practitioner conference that's up in Tennessee, Johnson City. And they do kind of a broad smattering of topics. They're like 1-hour lectures over the course of 4 days. And typically it's about 32 hours of continuing ed, but it's very good, and it's very kind of bringing everything up to date, what's new, like the new guidelines for treating hepatitis C. There's a very good speaker that does that. So last year, you're seeing all that on the news now. Well, I heard about that 2 years ago, but it's in, I try to keep current with going to continuing ed events.
Yeah, I
A
think
lot of
as
free
nurses,
and-
we always need to keep.
Oh,
learning.
absolutely. And again, everything, the diabetes meds, for instance,
Yeah.
I have some of the internists come to say, what is this med? What is this? What is the new one? What's the new, the U5, the U300 insulin,
Yeah.
the Trigeo. Oh yeah, that's it. So, it's interesting how you've gotta keep up because it's moving fast right now.
Yeah.
It's moving fast.
So tell me when you've made a clinical decision that profoundly impacted the life of a patient.
Wow. I think one of the most interesting things, and the thing that brings this to light, is I saw the little gentleman and his wife out eating dinner a few weeks ago, and she saw me, and we had an opportunity to exchange hellos, and actually she gave me a hug, and he looked so good. I was just so impressed. But I was caring for a little elderly gentleman. He was probably about in his late 80s. I can't remember his exact age. He'd been in and out of the hospital 2 or 3 times and just not doing well. He was most recently like at the nursing home to go for rehab to be able to get back home was his goal.
Mm-hmm.
But again, he just wasn't doing well. So he came back into the hospital with respiratory failure. He was on BiPAP and he looked like he was failing BiPAP.
Mm.
So I'd called and asked his little wife to come in. I'd taken his BiPAP off for a few minutes to see if we could wake him up, if he could talk to me, and we were getting no response out of him whatsoever. So we continued him on the BiPAP, but while his little wife took the time to come in, and we talked about, what are the goals? What do you want us to do? Do you want us to put him on a ventilator? Because that's coming real soon. He's failing BiPAP, so the next step is he goes on a ventilator. Mm-hmm. And they were all tearful. Her 2 sons were able to get there. There were a lot of real supportive family, and I think he had a twin brother as well that was able to come in. And we consulted palliative care, and they were able to kind of take the family across the hall to a little conference, and I, went about my rounding of patients so I didn't get too far behind. But assured them I'd come back. And I did go back. One of the family members kind of stayed behind with the little patient, and then I went back in to see, check in, how are things going, and went back in, and he started to wake up, and he was pulling his mask off, and he pulled that off, and he was just very clear talking to me, and I said, where have you been? He said, I was down under the water. And he said, I could see this big light, but he said, I couldn't get up. He said, I couldn't come up. I couldn't come up and get a breath.
Aww.
And his brother was there, and his brother was just in tears.
Aw.
He had tears streaming down his face because, here he had turned completely around. So here this poor grief-stricken family, comes back in the room, kind of trickling back in, along with the palliative care doctor, Dr. Mackey, that was with them, and he's kind of sitting up in bed looking like, well, what are y'all doing here? It was the most amazing thing, and it had a profound effect on me, and how powerful, you don't give up on people.
Right.
You don't give up on them.
Yeah.
And, I think there is a time that you make decisions to stop things and to treat people with compassion and, allow them to have a very dignified death. Because death is part of life.
Right.
It's the end part, but it's part of it. But the family was so glad, and, that was probably a year and a half ago. Truly, it gives me chills even now to think about that. Just his expression and him telling me about that story, and I think he had a near-death experience.
Oh.
And I was driving home that afternoon, and it was raining. It was a spring day and raining. And here's this rainbow, and it ends right in front of my vehicle on the 4-lane. And I'm like, wow, this has been a profound day. But then,
imagine.
I'm out eating dinner. Me and my husband are leaving the restaurant, and here they come in, and he's walking in. And this has been like at least a year ago. So,
Wow.
He's kind of made a recovery, able to get back home, able to be back with his wife, and they were able to go out and have dinner.
Makes you feel good about what we do.
Absolutely. It makes you know that, caring about people. I think we are human beings. We care for other human beings, but there's a difference in caring for someone and caring about someone.
Yes.
And I try to put both of them in what I do on a daily basis.
Yes. So what advice would you give a nurse that is halfway through the process and on her way into nurse practitioner school? The best thing that I could do for the future.
Well, I say, be a sponge, learn everything you can. I take the time and, it's not just the patient in 305. I mean, there's a person in there that has family. They have, they have sorrows, they have happy times, they have, goals, dreams. And I try to learn a little bit about the patients, that I care for. And that's been something down here. I wasn't sure how being down at Swain here was going to be, because I've always worked in Silva. That's my home. That's in terms of work. That's my place I love to work. But down here it's been equally rewarding because the patients are very similar. Some I've known because I grew up in this town. They've known me. They knew my parents. They know my brother. They know my sister. They knew my grandparents.
Right.
And it's been very rewarding. So, kind of just keeping yourself grounded. In terms of, do I know everything? Absolutely not. Will I ever know everything? Oh, no. There's too much out there. But the thing is, in assessing patients and caring for them, I'm confident I know what normal looks like. So if you know that, it's easy to recognize what abnormal is.
Right.
And then figure out, okay, why is this abnormal? I like to put all the pieces together myself. And then sometimes I think it's very fair to say to the patients, I don't know why you have this. I don't know. But I always, rely on the physicians that we have access to, and I utilize them. And the patients and the families, they appreciate honesty, one.
Yes.
They do appreciate that. They appreciate information. I try to give them the information. I try to tell them the whats and whys to what I'm doing and why I'm doing it. Mm-hmm. So, I would say that would be my advice. Keep them in the loop in what's happening, and, just rely on your physician cohorts that you work with, and, they're good. But again, I try to, when I go to them with a question, I don't go with them with the expectation you're gonna come in and fix this patient for me,
right?
Because I can't. Help me. What should I do next?
Right.
That's really what I'm looking for. Right. More guidance than come in and rescue me.
So use the tools that are available to you.
Absolutely. And having good assessment skills, I think, is your first and foremost.
Yeah.
Those things you should be able to know and do well. Okay. Do I know every diagnosis and every, little nuance? No, I don't. But if you know what normal is, then it's easy to recognize what's abnormal. And then you go from there.
Well, thank you. I want to thank you for taking the time to interview.
You're welcome.
And I want the class to know that Rita has been my inspiration since way back when I was a CNA. Rita was the nurse practitioner that I first ever worked with, and she's always encouraged me, always said I could do this. And I experienced my first loss of a patient ever with Rita at the bedside as a CNA, and I appreciate Rita, and she's been my inspiration. And if you can find somebody that can be your inspiration and is such a wonderful role model and is always there willing to help you learn, I suggest you hang on to that person, and I thank you very much.
Thank you. Glad to do this.